Hi everyone, welcome back to the URBOND podcast. Today we're here with the NHS. We've got Dr. Zaid with us today. We're going to be speaking about the work that we've been doing with the NHS around the COVID and flu vaccination campaign. We've also got Martina with us. She's a community champion working under the project. I'll hand over to you guys to introduce yourselves a little bit more.
Yeah, thank you. So my name is Zaid. I'm a GP in Houndean in Hampshire and one of the clinical directors in Hampshire and Isle of Wight Integrated Care Board, or the ICB. And thank you so much for inviting us to talk about the COVID and the flu campaigns and the vaccinations. And also thank you so much for all the great work you're doing for our community. Absolutely, I've got a big passion about bringing our community together and supporting our community. So thank you very much.
Thank you so much for coming. I'm one of the community champions. We've been doing 4 different workshops with our communities. So basically, it's great that you're here. Thank you so much for your time. Because obviously, we've been trying to address the COVID situation with our community, but there is a lot of information that we don't have. So having a professional here answering those questions is fantastic. So thank you so much for being here.
So the first thing we'd like to discuss is around trust. So I think within the communities we've spoken to, there's a lot of mistrust from the government and the NHS, but Martina can add a little bit more on
so
that.
One of the things they mention is that they believe, or some of the communities believe, that COVID-19 was something that it was created, and so the vaccine. So they didn't trust the fact that we have to have a vaccine because it was not natural. So how can you explain to them? How can you break that myth, if that makes sense?
Yeah, I think it's a really good question. And I think the most important thing is we listen to people's concerns. So obviously people have concerns because they think it was manufactured illness, and then we created the vaccine for that. So the first thing I will say, yes, thank you for asking this question, because it's important to listen to their concerns and address it and explain to them why it is not a manufactured illness. COVID-19 is like many diseases that can come and cause pandemics. There are so many diseases that actually we don't know why they happen. And COVID-19 is one of these illnesses that came in 2019 and then spread across the whole world and caused a huge amount of illnesses. We lost a lot of our friends, loved ones. The main thing we say, it is absolutely not an illness that has been manufactured. It is like any other disease that comes and then we just discovered it at that time. The vaccine itself, again, the thing we need to really be proud of, over the years, the many years, when illnesses happens, it took years and years and years to find out what we can do to stop them happening. And it killed millions and millions of people, many diseases in the past. The first case was reported in January, and by March we had to have lockdown. By December we started the vaccination program. So all that effort that has gone into to find out, and the trials to get a vaccine that can stop spreading that infection, and it did. By December we started the vaccination program, and you can see the number of hospital admissions gone down, the number of deaths significantly gone down, and the illness itself started becoming milder and milder. And so that's something we are really proud of. Within months we managed to start a vaccination program and protect our people, our loved ones.
Definitely, that's great. And obviously for the NHS, and I think that's something that the community was aware, that was something that it came up from nowhere, let's say, and the NHS, the professionals in the NHS were affected by it. It was a very stressful moment, and it was like everyone, I think, felt really proud of the NHS, but there was a few concerns and things that maybe the communication wasn't getting to the minorities we work with. Mm-hmm. So it's about how we can work together to solve that situation.
Yeah.
One of the other things is they mentioned is that the vaccine had a chip, and the government could track you where you are and put information in your body without them wanting to. What can you say about that?
And again, so I have heard that question as well from some friends a couple of years ago. And the vaccine itself, again, as I mentioned earlier on, is important to listen to people's concerns, because that's probably, if they have heard that is putting them off from having the vaccine, which will put them at risk and then put others at risk, because if they catch the infection, they can spread it. So the vaccine itself absolutely does not have a chip. The vaccine has got certain ingredients in it. It's available actually online. Anyone can look up the ingredients. We are happy to share some information with you to tell you exactly what is in the ingredients, because there are a few various types of the vaccines. The vaccine is the same for COVID-19 vaccine. However, there are different brands. They all have ingredients, and the ingredients are available. I am very happy, I say to friends and families who have asked me, some of my patients is very happy, look what we have website, look at what we do and how the vaccine is presented. This morning, for example, I was doing a COVID vaccination clinic and a flu clinic, and the vaccine comes in a vial. You take 6 doses from it. I aspirate it myself and inject it. It's not like a pre-filled something that I don't know what it is and I inject it. And I just want to reassure people, there's absolutely no microchip in the vaccine. I've vaccinated thousands and thousands of people over the last 3 years and a bit. And in the past, we used to dilute it. Now we don't have to already dilute it. You aspirate the dose from the vaccine and give it to the patient. So certainly there's no microchip, and nobody can be tracked by having a vaccine.
Good. That's good to know. Another thing that they mention is that some religions or some communities, they believe the COVID vaccine and the vaccinations are evil. So it goes against their belief. And I think when we tackle the religion side of it, it's a bit more difficult to explain that. So how do you think we could get to these communities and explain that this is nothing to do with religion?
Yeah, again, absolutely, I respect all religions and I respect people's views. The COVID-19 itself, if we describe it as evil, it's actually the symptoms that it gives, like an evil symptoms. It's horrible symptoms it gives, like many diseases that make us lose our loved ones, families, friends. The disease itself can cause significant problems. We can lose our life if we don't do something about it. The vaccination itself, I would not describe the vaccination as an evil thing, because actually the vaccination itself stopped us from spreading the infection. And even if people catch infection after having the vaccination, the symptoms will be much milder, which means that the risk of having serious illnesses will be less. Was there anything else apart from religion that you think people think that vaccination itself is evil or the COVID itself is evil? Was there anything in particular actually they are concerned about?
I think it was about the lack of trust on professionals. I think when you are coming from another country, you don't know the system, how it works properly. So you trust more the people from your community. And if they tell you something, you take it as a fact. So if we have any leaders of the community saying this is not a good thing, you should be having the vaccine, it doesn't matter if a professional or doctor is coming to you and telling you the opposite, because you're not going to believe it. So I think it's about that lack of trust and building this relationship with the minorities as well, how to make them trust professionals in the NHS.
Exactly. So thank you for clarifying this. And again, COVID-19, when it came in, there were so many unknown answers. That's why there's a huge amount of research, and there's still a lot of research ongoing and undergoing about the vaccines, about the COVID itself. Is a disease that came we didn't know much about, and we started learning about it as the disease started spreading and started controlling the symptoms. So I can see why some people think this way, but the disease itself is like many diseases that we know about, and also many other diseases that we might not know about. But it is not related to religion, and it's definitely not like a spirit or something like that that can affect your body.
That's good. Will you be able to explain a little bit how vaccines work and what's the benefit of them? I think like a general information would be great to pass to the community.
Of course. So as we mentioned earlier on, COVID vaccine is only one vaccination of hundreds of vaccinations available to stop us from becoming ill, stop us from catching serious life-threatening diseases. And the way it works, it produce an antibody in your body. If you catch any illness, then the antibody will get rid of that illness before it gets you. One thing I would like to say as well, without the vaccine, we would have had so many illnesses, we would have lost so many of our friends, family, community. I'll give you an example, the smallpox, which killed millions and millions of people over the years. By inventing the smallpox vaccination, that not only reduced the risk of having the smallpox illness and the complication including death, that eradicated it across the whole world. So again, we are very proud that we have managed to find something which actually goes back to the history a long time ago, that smallpox, but now we have no smallpox cases in the world. Another thing which I always talk about, the polio vaccine, which caused a disease called poliomyelitis, which you might have heard about. The disease itself caused disability, life-threatening conditions that affect children, but then they grow with a big disability affecting their legs and the way they walk. by finding the polio vaccine, that has significantly reduced the number of cases. And I'll give you an example. Back in the 80s, 1988 or 1990, I think there were about 350,000 reported cases. In 2021, there were only 6 reported cases. And the aim is by 2026 to eradicate polio completely from the world. And other things. Imagine if there were no vaccination. We will all stop going to holiday, or we go on holidays with a big risk that I might catch something, not just making myself ill, then bring it back to the country that I live in and spread it. So vaccination has significantly changed the life of all of us. Other things, big vaccination program for our kids. You know, the babies vaccination program where they have it at 8 weeks, 12 weeks, and 16 weeks, and then when they are older, that changed lives as well, because it stopped them from getting serious diseases such as meningitis and all the other things. Polio is one of them, diphtheria, and all the others. I'm not going to list all of them. The HPV vaccine as well, and the HPV virus can cause cancer, and cancer can kill people. So that is now done in schools at age 12 and 13 years old. They get that as part of a school vaccination program to stop them from getting the virus and then getting cancer in the future, which can kill them. So I can talk about many other vaccines that actually changed our life completely, not just adults, even when we were children, to stop us from getting diseases when we are older.
Thank you so much for that.
You're very welcome.